Hey guys, it's Chandra. I'm back. So I wanted to do a follow-up video to my 265 question NCLEX, video. So, I think it's important that, obviously we discuss what occurs during the NCLEX and taking in and sitting and waiting for the results and doing the quick results and doing the Pearson VUE trick. But I think it's equally as important for us to discuss what happens after. So obviously, many of you are going to be new grads and may or may not have experience. So I just wanted to share my interview experience, what I did, because particularly for people who are coming new into the nursing field or to the health field in general, it could be a very big curve for you to be able to, I don't want to say beat out potential candidates, but to try to make sure that you are able to secure your own spot and your own place, especially if you don't have any experience. So really briefly, I will say in my situation, even though I'm still going to provide you with tips and tricks and stuff like that I did, I would say that I'm very fortunate to have attended a school that was attached to the hospital, because the school that I attended, the hospital was a teaching hospital. So I was really fortunate in that. So the last semester, the HR recruiters came in and they spoke to us, and they basically just to get a sense of who we are, and they asked us to provide resumes. So if you do have a school that does that, please, 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 please take advantage of it. I was telling, when I was in my last semester, I was telling a girl who was in her first year that the HR recruiters come in your last semester, and she's like, oh, well, I really want to work at this hospital. I'm like, why not? You're doing your clinicals here. You're receiving instruction here. So how is it that you're not too good to attend the school, but you're too good to work at the hospital? Listen, I'm going to be very frank. If you have no nursing experience and you are coming out with just a 2-year degree, you don't got a whole lot of options. A lot of hospitals now are magnet status hospitals. Magnet status means that, if I'm not mistaken, 95% at least 95% of the nurses there have a continuing education degree, meaning that they have a BSN. You are not going to be, well, I don't want to say you're not going to be, but it would be very difficult for you to convince that hospital for you to be the 5%, because most of the time that 5% is relegated to the nurses who are already there and have a contract that they need to get their BSN within the next 2 years. So, like I said, if you're coming out with no nursing experience, no healthcare experience, and you have an associate's degree, you really can't be picky. Even if it's, this is not your dream hospital. Say, for instance, you're somebody who wants to do oncology and Memorial Sloan Kettering is your go-to dream hospital. You gotta crawl before you walk. I don't understand how some of these people who are coming or new nursing grads are running, sprinting. They're not even trying to crawl. They're not even trying to walk. But anyway, I digress. So I handed in my resume. I made sure to make constant eye contact with that HR recruiter, made sure that I told him my name. I even emailed him that day or the following day, thanking him for coming into the class. Because here's the thing. You and everybody else is going to be applying for nursing positions, particularly as a new grad. So if you're a new grad, they're looking at you like you have no relative experience. What about you stands out? You need to be able to put a face to a name. That's what they're concerned about. Because if they can't remember you, they're going to bypass you. So I followed up. I had my interview January 9th. Now, dress. I like to go a little hard. So what I did was I looked at the psychology of different colors to wear in job interviews. So I'll go into really briefly. Red, big no-no. So as much as red looks awesome on my skin, red can be perceived as overly confident and it convinces the interviewer to make quick decisions because of the way that red is interpreted by the brain. So red, no. Blue, your blue signifies teamwork, which is why I wore blue. I wore royal blue. I love that color too. Also very nice on my skin. So I did royal blue. Blues, grays, whites, blacks, you can't go wrong with. Try to stay away from the like eccentric colors, you know, your teals, your emeralds, your oranges, your pinks. Well, maybe if you do like a soft pink, but you want to do things that make the interviewer feel at ease. And blue stimulates a feeling of comfort in the brain and also signifies teamwork. So that's why I just say, for me, blue is definitely it. So I also wore a two-piece suit. I had my blazer, I had my button-up royal blue shirt, and I had my pants, and I had my heels. So this is why I wear heels, because again, I like to look at the psychology of interviews. So, and obviously before nursing school, I was actually a psych major. So I like stuff like that. I like to understand how people perceive the world. So I wore heels. People who are taller tend to get more job interviews and more callbacks. That is just a well-known fact. And the psychology behind it is, if the interviewer is tall, you're more inclined to make that eye contact with them, and you're looked at as on an eye level with that person. So I didn't wear like, you know, get a girl heels or anything like that, but I did wear like 2.5 inch heels, just because I'm 5'4". So I want to at least be 5'7", so I'm not like, hey, how you doing? You know? So I went to my interview. So I don't know if everybody else's experience is going to be the same, but mine was, I met with the HR recruiter, and they basically asked me what my clinical experience was, what my clinical experience was, and they also asked me who I would list as a reference. Now, I came in with 3 copies on good paper of recommendations from me, you know, from my clinical instructors. They surprisingly didn't want it, but I would say to at least have 1 letter recommendation, because even though this hospital may not have asked for it, there may very well be other hospitals that may want that or request that. But they did ask me for a reference. So I gave one of my clinical instructors, and they said 2 things, and I want you to start thinking about this now before you go into interviews. One thing they asked me was, what would that person say about you and your work performance and your work ethic? So you know what, she would say that I'm a team player, I'm definitely eager to learn, that if I am completed with my work, I don't just sit idly by, I do go and help others. So I am willing to take the initiative without having to be micromanaged. So he's all good. So he said, you know, and this caught me off guard. He said, what would she say negative about you? And I'm like, I don't know, like, because the instructor that I gave as a reference in particular, she loves me. So it's like, I couldn't think of anything negative. And it wasn't until I left that portion of the interview where I was like, you know what? She would say that, like, I constantly get in my own head and I second guess things because I want for things to not be messed up or wrong. But I'm like, you know what? Maybe it's better that I didn't say that, because it also sounds like I'm unsure of myself and I don't want to portray uncertainty. I want to be able to portray not uncertainty, but I'm willing to double check. I'm willing to triple check to make sure what I'm doing is correct. Okay. So other than that portion of the interview went well. So now I went upstairs, met with the nursing managers. This is what I will stress. Make sure you have questions prepared. Please. If this is not a hospital that you did your clinicals in, get some information on the hospital. Show that you're interested, because you cannot go, especially if you're somebody who's coming in with no work experience in the field, you cannot come in there and just, in my opinion, wing it. I will say for almost every job I've had I've almost always, I mean, not job, but job interview I've had, I almost always gotten a job. Even when I wasn't in the mood, like even my last job, I was at my last job for 5 years. I was an hour late and I still killed that interview because I'm like, you know what? What if I somehow needed that job as as a plan B because I already was being considered for another job elsewhere. You know what? Let me do some quick information while I'm like driving my car. Don't recommend that. And, see what I can find out about the agency. So yes, make sure that you're doing stuff like that. Make sure you're researching the hospital. Maybe the hospital is known for something. Like, I'll give you an example. This is not where I'm working, but this is one of the hospitals I wanted to interview at, so I looked at them up. LIJ in Long Island, it has the first in the country's robotic doctors that can perform open heart surgery. I thought that was extremely cool. Now, as a new grad, you wouldn't be going into the OR, but it shows that you have interest. And for me, if I had gone on that interview, I would have said, I like that LIJ is leading the way in progressive treatments, and they're looking into new advancements into providing appropriate patient care. Stuff like that is what you want to say. So I looked up the information for the hospital that I'm working at now and did the same thing. So I went in for the nurse manager interview. They asked me about my clinicals. Please, 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 dear God, please remember your clinical experiences. If you don't have prior experience, they are going to ask you about your clinical experience because they want to know, what have you learned? What procedures you may have been involved in, or what things you might have done. So I told them, I said, I did my clinicals on the medical surgical floor, telemetry, the medical surgical floor that included vents. I did wound care as a clinic because one of the floors in the hospital is dedicated strictly to wound care. I said I worked on the wound care unit, which the nurse manager was very impressed about because she was like, "Oh, I didn't know you guys did your clinicals there." I said, "Yeah, of course I did it. I did a clinical experience there. I did maternity. I did peds at another facility because the hospital I work at doesn't have a pediatric unit, and psych. I did all of those things." So it's very, very important because, like I said, they want to know. So I explained to them, I did PO medications, IM injections, which includes heparin, insulin. I drew up meds. I did IV piggybacks. I sized and cultured wounds, which is important because they want to know that even though you may not have experience in the workforce doing it, you at least have some familiarity in the clinical portion. Like I assisted with a catheter. I did suctioning on a tracheostomy. You want to show those experiences because those are your experiences. That is your skills. So they basically were telling me, about the schedule and everything like that. So this is what they asked me, if I had any questions. Please have questions. Have questions. Even if it's 2 or 3. Now, I have more than 2 or 3. I'd say I had about 13 questions. I did try to find the questions that I written down. I must have deleted them. I had a notepad that I was walking around with that had the questions in it. I have no clue what I did with it. I really, really did try. But I did remember some of them off the top of my head, and I want to share them with you now. So one of the first questions I asked was, what is the culture of the hospital? So when I say culture, is it a culture of teamwork? Is it a culture of evidence-based practice, of support from nurse management? Is it, things like that. Another question I asked is, and which is very important to you as a new nurse grad, is what is the orientation like? What is the length of the orientation for a new nurse grad? Because if they tell you the orientation is 2 weeks, run like hell, because you just got your license and you cannot jeopardize losing your license because they haven't adequately trained you. So they told me my orientation is about 3 months. So I'm like, okay, good. That I'll be working with a preceptor every day, hands-on, good. That they would check in, that the nurse manager would check in with me every other week to just kind of track my performance, discussed with me where I could have some areas of improvement, which I thought was good and helpful too. And then after 3 months, because my probation is 6 months, they would discuss how comfortable would I feel with going onto the unit and being solely responsible for my patients. And they did say to me that in the event I don't feel comfortable after 3 months, they can extend it for, I think, like another month, just to give me some time. But, you know, you can't extend it forever. Like, oh, this is year number 6, and I'm still not comfortable. So there was that. And I asked them also, I'm trying to think off the top of my head, I asked them what has been the successes of the unit. So, you know, in terms of HCAPs, which is something that they're going to talk about for forever, and aided. So, has the unit seen a decrease in infections? Has the unit seen a decrease in duration of hospital stay? Things like that. You want to see that the unit, the nurses and the CNAs are on the same footing in terms of making sure that we're following evidence-based practices to ensure we have better patient outcomes. Things like that. So that's why I said, what are some of the achievements? Another question I asked is, how do you motivate your staff? Because here's my thing. I know for me, I have a good work ethic. I do not like to be micromanaged. I hate being micromanaged. I'm the type of person that I believe in doing my job well, and doing my job effectively. So there's no need to say, Chandra, what are you doing now? Chandra, what are you doing now? I don't like that. I do not like that. However, and in every field you go in, there's going to be that one person that you know they're going to do the bare minimum and go home with the same check as you while you're actually putting forth the effort. And to me, that's not fair. You do your patients a disservice when you allow another nurse to not, you know, carry their weight and never pick up their slack. Make them carry their weight. So she was telling me how they motivate staff to make sure the staff is involved in patient care and they're adequately doing their job. Okay. Another question I asked is, what is their managerial style? Which is very important because, you know, some people prefer that kind of laissez-faire, laid back, hands off, you know, I trust you guys to do what you need to do style. And maybe that's effective for some people. And then others may prefer a more democratic style where the nurse manager wants to implement something, but wants to also make sure they get feedback from the nurses before implementing a policy or a change or something like that on the unit. So that could work for people also. Some people, I don't know who, but some people will prefer a totalitarianism managerial style where I tell you what to do, don't ask no questions, do what I say, not as I do. Maybe that works for some people. Some people like the whole dictatorship vibe. So I asked that. And then another question I asked is, how do they, for me, which I thought was very important, how do you make your nurses feel appreciated? Because at my old job, I definitely felt like I was just not appreciated. And like I said, I'm a hard worker. I have a great work ethic. And I felt like the mentality I got from my managers was, well, if you're doing a good job, oh, well, that's what you're supposed to do. That's your job. And it's like, yes, it is your job, but people also like to be appreciated. You know, especially if you are that person who has a great work ethic, you want to feel like what you're doing is not in vain, that people see that you have a great work ethic and appreciate and reward you for such. So they said, you know, they have a lot of food and cake and ice cream and cookies and hot food and pizza and stuff like that, which I'm like, oh, live for some food. So free food? Yeah, absolutely. I'm there. So I said, okay, cool. So what I did was I asked those questions. Those were all the questions. Like I said, I had 13. I just couldn't think of the other ones. I think I did ask about scheduling, like, you know, 12-hour versus an 8-hour, stuff like that. Whether or not it's self-schedule, meaning that the sheet is open and available for me to plug myself in. Oh, also, keep in mind, you may or may not have to rotate your weekends. A lot of nurses do that. So like me in particular, I have to work at least one weekend. And yeah, I have to work at least one weekend, full weekend, meaning Saturday or Sunday. And if you're somebody who's working only the 12-hour shifts, you have to work at least 1 week of 4 days, because they want your hours to total up to like 40 a week. And if you, total up to 40. And if you're only doing 12 hours, you're not really making full-time status, as what they explained to me, because it's 36, 36, 36. So that last week that you do the extra 12 hours is like adding the 4 hours to that first week, the 4 hours to the second week, the 4 hours to the third week. So that way it does look like you're actually receiving 40 hours for every work week. If you still don't understand, you can definitely message me in the comment section and I'll explain it further. But they were very impressed when I pulled out that notepad and had my questions. So even when we were actually getting kicked out of the office that we were in because a meeting was going to happen. So I'm like, oh, well, I guess, you know, that's the end of my interview. And the nurse manager was like, no, she's like, I see you came with questions. I really want to take the opportunity to answer all your questions. And I appreciated that. So she definitely pulled me into another, well, I was interviewed by 4 of them, you know, one representing different, each one representing a different unit. So I went over to the other office and they completed my questions and they called me back. And yeah, that was it. They called me back. I'm trying not to let this one run a little bit long, but it's looking like it's about to be as long as my NCLEX story one. So I'm gonna stop it here, and then what I'll do is I'll pick up with a second video explaining the process of me finding out that I had my me passing my NCLEX, because at the time that I interviewed, I hadn't even sat for the NCLEX. I haven't sat for the NCLEX, so they didn't know I passed, anything like that. So I'll pick up on my next video explaining the process from me finding out that I passed, to contacting the hospital, to the pre-employment hiring process, orientation, which is the classroom orientation, and then some of my actual orientation on the unit, because right now I am actually still in the orientation process. I'm coming up on my 3rd week of orientation, so I want to discuss all of that briefly. Well, not briefly, because that's going to be a lot. But like I said, I don't want this video to run too long, so I'll just leave it here at the interview process. So I'm going to try to post that next video as soon as I can, maybe about a week, within the next week or 2. But like I just said, I wanted to put out this video because, you know, this is graduation season, and I think it's very, very important that, you know, you guys go in with a sense of what to expect during the interview process. So this is it from Chandra, Nurse RN, signing off. Have a good day. Make sure your interview is successful. Wear blue. And have a good day. Bye.